Hi, welcome to the McDoodles for Your Noodle episode on SLE, Systemic Lupus Erythematous. So, we are going to start with a supernatural story with werewolves, starring a young woman named Bonita Duck and her friend Quinn Smith III, who is a werewolf. And lupus, the name, comes from the Latin lupus for wolf. And this is because the lesions on the skin looked like wolf bites. So we have Bonita here. She's a young woman. That's to remind you that lupus, like other autoimmune diseases, occurs more often in females compared to males. It said between a 7 and 15 to 1 ratio, so I just put about 12 there. And then Bonita is Spanish for pretty. And this is to remind you that there's an increased incidence of lupus in Hispanic, Black, and Asian populations. So not so much our example here of a white woman compared to those populations. And then bringing back in her friend Quinn Smith III, his name is going to mean something for the rest of this video. But for right now, the third is to remind you that lupus is a type 3 hypersensitivity. But it also has autoantibodies, which means that it's also type 2 hypersensitivity. And to remind you of that, you can think of Quinn Smith's father, Quinn Smith II, who has an auto body shop where he works on Bonita's truck. And then finally, Bonita and all of these people in the story live in a fictional place called Spoons, Washington. And the spoon can remind you of spoon theory, which is a theory about chronic illnesses and other disabilities, that a person living with these conditions has only a certain amount of spoons, as in energy, to go about their daily activities. If you want to look more into spoon theory, you can Google it. And Washington State is a cloudy place, and this can remind you that people who have lupus should be avoiding the sun as much as possible because of UV rays. So symptoms for lupus include fatigue, as we mentioned previously, the Spoons, Washington. Another symptom is fever, and we're bringing in another character to this supernatural story, this vampire named Iggy Anna. And like Quinn Smith III, his name is going to come up in the rest of this video, but for now, just think that he made Bonita feverish when she first met him. She got all hot and bothered over him. And then we have acute cutaneous lupus erythema, and that is where you see the classic butterfly rash looking presentation in a malar distribution. And this is also a reason that it's good that she lives in Washington, because she wants to avoid the sun, because the sun can exacerbate these rashes or cause them to come out. Also, another clinical manifestation of this disease is pericarditis. So the symptom would be chest pain. And you can think of this as that the vampire broke Bonita's heart, and so it gave her chest pain. And then also another clinical manifestation of this disease is anemia, leukopenia, neutropenia, thrombocytopenia, a bunch of penias and emias. And you can remember this by the fact that vampires suck blood, and people with lupus may have low blood counts. And then with these emias and penias, we can also have a higher likelihood of thrombotic events. You can have arterial or venous thrombosis, and so that's another concern with lupus. And because of these issues, you are at higher risk of having a miscarriage if you have lupus. Another very common symptom, arthritis, arthralgia, and myalgia. And one thing that is a classical presentation is hand pain. And we see this specific hand deformation called swan neck. And I don't know why you would think of swans when you're looking at this, video. No one's name is Swan. But, her last name is Duck, so maybe that'll help you. We've also got Raynaud phenomenon, where we get spasms in the fingers that can be triggered by cold or other things, and that can cause your fingers to look really pale or cyanotic and can even cause ischemia. And vampires are cold-blooded and they have cold skin. So that's how you can think of Raynaud phenomenon for lupus. And then the next common clinical manifestation is lupus nephritis. And you can think of this as, in our story, Bonita, our heroine, gets stabbed by a evil vampire right in the kidney. And there are several classes of nephritis due to lupus, but class 4 is the most common and the most severe, and it involves half or more glomeruli, and it can cause hematuria and proteinuria. Why are all these clinical manifestations coming about? Why are all these symptoms happening? Lupus is essentially, again, an autoimmune disease where there's defective self-tolerance. So I remember this as, in our story, the vampire goes away and breaks Bonita's heart. And so she kind of feels like she can't tolerate herself because there must be something wrong with her for her man to have left her. And this defective self-tolerance, when environmental damage occurs, like from the sun, which I mentioned earlier, UV rays, some other kind of environmental damage, that'll cause apoptosis. And this is kind of dark, but, maybe Bonita is so sad that she's contemplating sort of apoptosis. And then there's inadequate clearance of the nuclei. Kind of like when you're depressed, like Bonita is here, you might inadequately clear your room, your space. You might not clean very often if you're depressed. And that inadequate clearance leads to stimulus of self-reactive lymphocytes and increased antibody production by those lymphocytes, leading to complexes of the self-antigen and antibodies, and that also increases interferon and cytokine release. And then we kind of have this feedback mechanism where things just get worse. And so we can see these flares is what they're commonly referred to as, where it's a worsening of the disease, and then sometimes the disease can get a little bit better. And I like to think of this process, this cycle, kind of like the cycle of time. Like Bonita is very sad, and so she's just going through time, and things are just getting worse and worse. And then back to these names that I said we're going to come back to. We've got Iggy Anna here and Quinn Smith III. And that Anna can remind you that ANA, or anti-nuclear antibodies, those things that I referenced in the complexes in the previous part of the video, are antibodies that are sensitive for detecting lupus, but they're not specific. However, if they are negative, it's pretty much certain that you're not looking at lupus for a diagnosis. And then for Quinn Smith, we've also got anti-Smith antibodies. They're very specific, but they're not sensitive. So if you have anti-Smith antibodies, you can be confident that it's lupus, but you might not see these because this isn't very sensitive. And then next here, another character that we haven't met yet is Bonita's dad. His name is Chuck Duck, and I may have made this entire video concept just so I could introduce a character named Chuck Duck. And he works double shifts as, whatever you want to think him as. He might be a cop, he might be like a mall security guard, whatever you want to think of. He works double shifts, and that can remind you that another antibody that's detected is anti-double strand DNA. So these anti-Smith and anti-double strand DNA, they're going to be the ones that are more specific towards diagnosing lupus in lab tests versus ANA we're going to see in a lot of different autoimmune disorders. And then a little bit more about Chuck Duck. At some point in our story, Bonita is looking very gaunt and skinny. He just wants her to know that she can tell him anything if something's going wrong. Is she on drugs? What's going on? And that little question right there can remind you that there's drug-induced lupus. And we see antihistones in testing for drug-induced lupus, but we also see them in SLE. So that's not as distinguishing in trying to determine if it's drug-induced lupus versus idiopathic lupus. And so more specifically, we see that when you stop taking the drug that induced the lupus goes away. And also, kidney and central nervous system involvement are rare. with drug-induced lupus, and they also tend to improve if there's any kidney or CNS problems when you stop taking the drug. Some of the drugs that can induce lupus are hydralazine, procainamide, and D-penicillamine. And then finally, we're going to address Quinn's first name. Quinn can help remind you that one of the first and very common drugs prescribed for lupus is hydrochloroquine. It's actually originally an anti-malarial drug, and it's also an aminoquinoline. And it's generally well tolerated, and side effects are rare and can help reduce flares. It's immunomodulatory. It can provide protection against thrombotic events that can occur with lupus, and it can also prevent renal damage as well as decrease cardiovascular risk, because there is an increased risk of coronary artery disease with lupus. Other common medications that might be prescribed are steroids. Might be encouraged to continue to take NSAIDs, and that's due to those anti-inflammatory properties because we have inflammation with lupus. They can help with pain, and they can also help with fever. And with the fever, I just want to mention that with lupus, as you're on these immunosuppressive drugs, you can get infections more often. And so it's important to determine whether the fever is from an infection or from the lupus. And if you're taking NSAIDs, the fever will go away if the fever is due to lupus generally, and it will not go away if it's due to an infection. I've got my references here. And that's lupus. It's not comprehensive, but it's a lot of important stuff.